Welcome to today's Explainer. We've got an absolutely incredible medical journey to share with you today. We're going to dive into the story of a patient who is facing a seemingly unstoppable physical decline from a rare disease, and how a brand new, groundbreaking therapy actually reversed it. It's a story of cutting-edge science, sure, but more importantly, it's about resilience and the hope of actually regaining the simple joys of everyday life.
Imagine for a second what it would feel like to slowly, day by day, lose your basic daily functions. The strength in your hands just fading away to the point where you literally can't even hold a pen. Your legs refusing to let you walk smoothly. And on top of all that physical frustration, your memory is starting to slip away too. That was the profound, frankly terrifying reality our patient was facing. And it really sets the stakes for what makes today's explainer so incredibly powerful.
Section 1. Progressive Decline and Diagnosis. So let's meet our patient. He's a 66-year-old Japanese man who just started realizing his body was steadily failing him. He was dealing with progressive distal limb dominant muscular dystrophy. What does that actually mean in plain English? Well, it means the muscles furthest from his center, so his hands and his feet, were severely weakening and shrinking. It got so bad that he needed an ankle-foot orthosis, basically a brace, just to be able to walk without stumbling. And if that physical toll wasn't enough, he was also experiencing this scary, gradual progression of memory dysfunction.
Now, what's really interesting here is the sheer physical evidence of this decline. If you look right at the base of both thumbs, you can clearly see the muscle atrophy. This isn't just some abstract clinical data point, This is what makes tying a shoe, using a pair of chopsticks, or gripping a pen an incredibly difficult, deeply frustrating task. We're talking about the literal loss of physical independence.
Section 2. CMT Mechanisms and Despair.
Ultimately, he was officially diagnosed with Charcot-Marie-Tooth disease, or CMT. It's actually one of the most common neuromuscular disorders out there, affecting about 1 in 2,500 people. But here's the truly devastating part. Historically, despite knowing about more than 100 different genes that can cause it, there have been virtually no real therapeutic cures. None. Patients are usually just offered basic rehabilitation, symptom management, maybe some surgery for deformities, and that's it. To make matters even more complicated, our patient was an APOE epsilon 4 carrier, which is a known genetic risk factor for Alzheimer's, so his CMT was complicated by memory decline, a dual threat with no known cure. Let's look under the hood for a second at the exact genetic culprit here. The patient had a very specific mutation, connexin 32S26L. Think of gap junctions in our cells as tiny little gates that allow essential communication between your nerves and your muscles. Well, this mutation essentially acts as a broken gate. The structural alteration means the pore just fails to open and close properly. So the nerves are shouting instructions, but the muscles aren't getting the message at all, which leads directly to that severe muscle wasting we talked about.
Section 3. Arrival of a breakthrough treatment. But as doctors, they didn't just accept this inevitable decline. Instead, they deployed a completely novel, two-pronged therapy. Step 1. A highly specialized cytokine cocktail aimed at literally growing new brain and nerve cells, a process known as neurogenesis. Step 2. An arbitrary waveform generator, or 8AW, which provides targeted physical wave therapy directly to the muscles and nerves.
Let's unpack that first prong. The patient received a really powerful cocktail of growth factors. We're talking HGF, GCS, adiponectin, insulin-like growth factors, and later on VEGF and brain tissue-derived exosomes. This isn't just basic nutritional support. This is like a biological instruction manual telling the body, hey, it's time to rebuild. The entire goal here was to induce neurogenesis, essentially repairing the structural damage in the brain and the nervous system that was caused by the Alzheimer's-like pathology and the downstream effects of the CMT.
Okay, let's dive into this second part, because frankly, it sounds a little bit like science fiction, but it is very real. To combat the muscle weakness, doctors use that AWG device. It emits alternating current signals at very distinct frequencies, anywhere from 1 to 10,000 hertz. The theory behind this is absolutely fascinating. By stimulating the tissues with these specific sound wave frequencies, they might actually be able to bypass or even rectify that broken gate in the gap junctions we looked at earlier. The idea is to force the nerves and muscles to communicate again on a cellular level.
Section 4. Functional recovery of brain and body. And this brilliantly illustrates the sheer power of this approach. We are looking at 3D MRI reconstructions of the patient's actual brain before and after the therapy. On the left, back in 2019, you have very visible moderate atrophy in the cerebral cortex. But look at the difference on the right, in 2022.
The volume of the atrophied areas in the frontal and parietal cortex has significantly increased. The brain tissue is literally regenerating.
But, new tissue needs fuel to survive, right? Looking at the blood supply, you can see these incredible changes. In the after-imaging, there are brand new blood vessels forming, a process called angiogenesis. This fresh, robust blood supply was absolutely crucial. It didn't just rebuild the physical tissue, it rescued the underlying neurophysiological activity. It brought his brain back online.
And bringing that hardware back online yielded some truly dramatic real-world results. This chart tracks his cognitive function over 34 months. I want you to focus on that red line down near the bottom. That is his verbal memory score. It starts out terribly low, deep down in the severe impairment zone. But as the cytokine and exosome therapies are administered, which you can see mapped out at the bottom, look at that red line just shoot upward. It climbs all the way back up into the normal zone. His memory wasn't just halted in its decline, it was completely restored.
We can actually see this repair happening in the brain's electrical signals too, specifically the P300 waves, which measure how we process information. Before treatment, the red lines show these suppressed, abnormally flattened brainwaves, which is a classic sign of global degenerative pathology. But look at the black lines after the treatment. They're smooth, they're symmetrical, and they have a much higher amplitude. This proves without a doubt that the neural networks in the cerebral cortex were successfully reconstructed. His brain was firing on all cylinders again. Section 5. Hope in regaining daily life. Just look at this stark contrast. Before treatment, this man was trapped in a failing body. He needed a heavy cast just to walk. His hands were wasting away. His mind was slipping, scoring a 28 out of 30 on his mental state exam. And after the treatment, he is walking smoothly without his orthopedic cast. He is feeding himself with chopsticks again. And that cognitive score? A totally perfect 30 out of 30.
You really can't overstate the emotional weight of these simple, everyday victories. Grasping a pen to write a quick note, using chopsticks with ease to just enjoy a meal, walking smoothly across a room completely unassisted. This explainer isn't just about clinical data and cytokine cocktails. It is about the profound, beautiful hope that comes with regaining your physical independence and pulling yourself back from the edge of what was supposed to be an untreated disease.
So the absolute crucial point here is this. For patients diagnosed with CMT, this represents a monumental paradigm shift in medicine. We're no longer just telling patients to manage their slow decline and make peace with it. We're looking at a very real future where we can actively restore their life and their bodily function.
Which leaves us with one final, pretty provocative thought. If we can use growth factors and targeted sound waves to literally bypass the broken gates of our genetics, if we can regenerate a human brain and give a man his legs and his hands back, what other so-called untreatable conditions might we conquer next? The future of medical regeneration is really just beginning, and we absolutely can't wait to see where it goes. Thanks so much for joining us for this explainer, and as always, keep your curiosity alive.